The patient is a 22-year-old female who presents to the clinic today complaining of perianal bumps, vaginal bumps, and an abnormal discharge. She says the discharge is yellow and she noticed these symptoms 2 days ago. The patient says she had unprotected sex 1 week ago with her partner and her HPV vaccines are up to date. She says she's had 3 sexual partners within the 12-month period. So with her symptoms and the circumstances, my main diagnosis is going to be HPV, and my differentials are going to be HSV, gonorrhea, and chlamydia. Upon physical exam, I noticed that the patient does not have any mouth sores, and the patient does not have any abnormal rash on the hands or feet. I notice also that the patient does not have any lesions, ulcers, or bumps in her perianal or vaginal region. The speculum exam shows a yellow discharge, and with the bimanual exam, there is no cervical motion tenderness, no adnexal tenderness on this patient. So with these symptoms that I see physically, it's going to refute my diagnosis for HPV because I don't see any warts and I don't see any lesions or ulcerations that would lead me to believe that it's HSV. And I also don't see any strawberry cervix that would make me think it's trichomonas. So my main diagnosis then is going to be gonorrhea. What other sexually transmitted diseases would you think to look for on this patient? My plan for this patient is going to be to do labs for gonorrhea, chlamydia, for HIV, and for syphilis. And I'm going to empirically treat her for gonorrhea with 500 milligrams IM of Rocephin because she does have a history of having gonorrhea and chlamydia in the past where she was treated with antibiotics. When the labs come back for the gonorrhea and chlamydia, if she has a co-infection with chlamydia, I would treat that also with doxycycline 100 milligrams twice a day for 7 days. Since this patient has had 3 sexual partners within a 12-month period, I also want to do a consult for her for PrEP, and that's pre-exposure prevention for patients who could be at risk for HIV. I want her to come back in the clinic in 7 days for her lab results, abstain from sex, and use condoms moving forward. My issue would be I want to learn more about PrEP. I want to know more about the side effects of this medication, the contraindications, and then labs that you would need to check on these patients. Thank you.